next speaker is going to be Dr. Yoav Keynan. Very good to have you on here today. And Yoav is with the National Collaborative Center for Infectious Diseases, and he's calling in today from Winnipeg. He's going to be speaking about some key equity issues he's seen show up in the response to COVID-19. And as we are focusing on COVID-19, the public health issues which you work on a daily basis are still with us. He's going to be sharing with us what he's seen public health not being able to do as a result of the COVID-19 pandemic. Yoav, on to you.
Thank you. Hopefully you can hear me. Just give me a note if you can hear.
We can hear you great. Thank you.
Perfect. Okay, so thanks for inviting me. I wanted to talk about a couple of issues that are related to some of what the previous speakers have already talked about. So basically the pandemic is exposing inequities and even creating bigger gaps in some of the issues. And some of those are related to the care provision. And across our country, there's a broad difference in testing strategy and access to testing. There is significant differences in the access to PPE, as already was mentioned, and the ability to do some of the key successful strategies. So if we look at countries that have had an effective response, it relies heavily on broad testing and effective distancing and isolation. However, the reach of testing in our big country is not even, as is the access to PPE, the number of people residing per household, and the access and the differences, the big differences between rural and urban. In terms of intensive care unit capacity, that is also widely different and varied across the provinces, and also between south and north. And we know from mathematical modeling of comparing the ICU capacity of the provinces across the country in a paper that should be coming out in next week, that some provinces are going to face deeper problems in ICU capacity. And obviously, when you go outside of the urban centers in each of the provinces, the ICU capacity decreases. In terms of our ability to access treatment, so there's no proven treatment, but there are some interventions that may come through in the next several weeks as a result of clinical studies across the globe. The problem is that those medications are already in short supply globally and will be difficult to access outside of clinical trials, making it problematic for people who reside outside of the main centers, urban centers, to access those trials, again, introducing inequity in how we treat and how we will be able to offer emerging information from ongoing research that is unprecedented in the speed and collaboration, but will have difficulties reaching everyone. And again, those are just some examples that show the gaps. The second point, or the second question that has been posed, is that what are we missing by the diversion of resources? So the same places where capacity is low are also facing concurrent epidemics of sexually transmitted and blood-borne infections, such as syphilis that is rampant in many parts of the country, and TB epidemic and TB numbers that are not controlled. And paying attention to what we're missing in terms of testing. Basically, some of the provinces have dropped testing for TB because of the bandwidth of public health is limited by tracing of COVID contacts. And the same can be said, I don't know how it will pan out, but imposing isolation in the face of STBBI epidemic can be good or can be bad, and we will see how it goes. But the point is that the resources that are reallocated are going at the expense of some other ongoing burning issues. In terms of harm reduction, again, that is approached differently between different parts of the country, but there is a reduction in availability of harm reduction, and Also, the flexibility of the platforms has decreased, as did some changes in shelters that are important for vulnerable population. The other things that are not being managed the same way are ongoing care, because closing, as we've heard from the first speaker, some communities are closed, but many communities in several of the provinces rely on visiting healthcare that's coming to the community to provide much needed services. And how do you manage those, and what happens to the management of diabetes in a community that doesn't have visitors, or people are not able to fly in or to drive in? So those are some of the issues. And on top of all of that, obviously the threat of the COVID pandemic on resources for mental health, combined with the need for isolation, as well as the economic issues that emerged during the pandemic, all of those serve to task even further the most vulnerable population. So those should be as part of their response. It's not just the number of ICU beds that you have, it's how those are distributed. And it's not just how effective the treatments are, but who will have access to those treatments. And last thing is to think about the day after this pandemic. What would be the recovery, not just from COVID, but from STBBI or from TB that is now transmitted in a household that is closed in a community that has high rates of TB. So those are some examples. I'll try to keep my discussion short so we can have some time for questions.
Great. Thank you, Yoav. Thank you so much, Yoav. And for those of you who cannot see what's happening here, I'll just share that the NCCDH has an amazing team, so you hear my voice. But we have a whole crew here working to make sure that the webinar is going on. We know you had some challenges here in Yoav, but we had to do a little bit of work around there, so thank you for sticking with us there. So I would like to thank all our presenters, and I think Yoav just said making those connections with what we're seeing really in mainstream media conversations around ICU beds, and really bringing that lens on how are those services going to be distributed. I think I saw someone in the chat there share an example of what is happening in terms of testing. So she's sharing that one of the key issues, equity issues she's seen, which has always been an issue in her community, is that some racialized individuals are being denied health care or having their symptoms minimized as they're not given appropriate supports and getting tested for COVID-19. So thanks for sharing that, because I think that's a concrete example of the points you're making, that we are going to be making decisions about who gets tested, who doesn't, who gets an ICU bed. And I think it's, as the presenters have been saying today, it opens up some of these inequities which we already know exist.